And we're live. I'm Jeremy Faust. We're calling this 1 year in, how the Trump administration eroded public health. Who better to talk about this and to anchor this hour session than with my friend, Dr. Angie Rasmussen. What's going on?
Not that much. Just another Tuesday in paradise.
Right. I mean, you and I have been having this conversation all year, and we're going to bring in today at least, I think, 4 guests we have. We have Dr. Gigi Gronvall, Dr. Noam Ross. They're going to talk about biosecurity and the NIH. And then we're going to have Dr. Paul Offit and Dr. Dimitri Daskalakis talk about vaccines and the CDC. You're a virologist. Tell me just from the standpoint of a virologist, where we are now as opposed to like a year ago.
I mean, we're in a pretty terrible place as a virologist on multiple fronts. So many of my colleagues in the US who are funded by NIH money have lost their grants. My colleagues working within the federal government who are virologists, many of them have lost their jobs. The people who are funding virology research have lost their jobs within the government. And virology research in general is being hindered by the executive order on improving the safety and security of biological research, which imposes 8 rules that basically you can't break, or it's considered quote unquote dangerous gain of function or DGOF research. Yeah. And so all of that has had a really profound effect on the amount of virology research that can get done. And meanwhile, today, we lost measles elimination status, not officially. That will happen at the PAHO meeting in April. Wow. But the CDC says that we haven't, but they're still getting some whole genome data together. I find it very difficult to believe, based on the few sequences that are out there, that this is not the same continuing outbreak. So
well, yeah, can you explain what that means? Like why the sequencing of measles that is out there tells epidemiologists whether or not the United States has lost its elimination status for measles? I don't think people understand that.
Yeah, I mean, it's a really great question, because a lot of people think, we just put stuff through a sequencer and like boop, boop, boop. It's like, here's the answer. And that's definitely not how it works. So what happens is when people get diagnosed with these viruses, you take a sample and you can get RNA from that. So you can get the whole virus sequence by sequencing it. Then you look at that sequence and you compare it to other sequences, and you look for variants, essentially. You look at when and where those samples were collected. You can compare that to outbreak data, and you can really trace the outbreak. No. But you don't actually have to get every single sequence. You don't have to track every single case, because if you know when you got them and you can track the mutations, you can infer how that virus evolved over time. And you can tell that the virus is circulating now, say in Arizona, Utah, or South Carolina, are derived from the virus that was circulating in Texas.
All right. So this is the kind of expertise that we want inside the government, not outside of the government. That, unfortunately, is not the case where we're at right now. I do want to bring in guests in just a minute. But again, from your standpoint as a virologist, you're starting to already see some of the signs of our threat readiness sort of being eroded in a way that we can actually kind of sense, right? A lot of things are hard to sense on the ground. People ask me, what are you seeing in the ER as a doc? And it's not showing up yet, because it's more of a long-term vesting. Eventually we're going to see things that'll be different. But at the moment, it's more like, oh, there weren't like any communiques from the CDC for months and months about outbreaks of concern. Some of that stuff is resolved and it comes and goes. But I think this measles one is something that the public can really grasp as, oh, this is something that's coming as a result of vaccine skepticism, vaccine denialism, anti-vaxxer fever dreams. And it's real. And I think that's really important that on the 1-year anniversary of the Trump administration, that's being discussed. I think what we should do is add to the stage our first guest. And this is Dr. Gigi Gronvall. Andrew, do you want to introduce her real fast?
Oh, yeah, sure. Absolutely. So Dr. Gronvall, Professor Gronvall, is at the Johns Hopkins University. She is a friend of mine. She trained as an immunologist. She trained actually at USAMRIID, the U.S. Army Medical Research Institute for Infectious Diseases. So she's originally a bench scientist, but now she's an expert in biodefense, biosecurity, health security, and all of the emerging threats that we face that are not just pathogens.
Thank you. Oh, I think you're muted.
Thanks for being here. And I'll let Angie ask the first question, since I should be a fly on the wall for this part of the conversation. That's why I was muted.
Yeah, I mean, I'd actually be very curious to hear Jeremy's thoughts down the road about security in terms of our health system, because that's a big part of pandemic preparedness. I mean, obviously, I think all the time about pandemic preparedness because I study emerging viruses. But I know, Gigi, for you, like, you recognize the threat that these emerging viruses present. But as we've discussed many times, and what Jeremy and I were just discussing, is that the inability to do research on these emerging threats is actually in itself a huge threat to our security. Sure. And I was wondering if you would share some of your thoughts about that.
Yeah, I mean, a lot of what happens with biosecurity that's important really overlaps with public health. So if you hack at our public health capabilities, you're going to make us less prepared to face any kind of unseen, deliberate threat. So not being able to perform surveillance, not being able to do research on diseases that will give you insight into potential ones that we'd be facing, all of that is bad. But it's worse than that. If I could make it, turn it up a little bit. Just before this year started, there was a really important report that was released. It was a 2-year effort. It was a bipartisan Senate commission. It's NSCB, a National Security Commission on Emerging Biotechnologies. They worked on this for 2 years to describe what the status was for U.S. security in biotechnology, how well we were doing, what we needed to do. And their big conclusion was that, like, even though biotechnology started in the U.S., we were really losing it. We were in danger of giving it all away, mostly to China. And it's not bad that China is investing in this area. That's a good thing overall. It's more that if they can control supply chains, then that could be a strategic disadvantage for the US. And so they had all these recommendations of things that we should do: investing in public health, investing in our research, really grabbing all the microbes that we can in Yellowstone, for example, all those extremophiles, and figure out, like, what are our resources. And instead of doing any of that, we've made everything worse and made science insecure and scientists insecure. Scientists are leaving the country, or they want to leave the country. And so it's really, it's kind of a disaster. I mean, go ahead. Sorry.
Yeah, I wanted to ask you about that, because you are actually not only in the field, you're in the academic field as well. And recruiting the best and the brightest from overseas is the way that America has succeeded. And that includes literally just like applications to graduate school and or faculty positions. Are you seeing a change here where we're not getting this year's crop of the next great scientists, or people going back to wherever they were born and saying, it's not really worth it to be here anymore? Are you seeing that erosion already?
Oh, yeah, absolutely. I mean, we saw some of that erosion before, because, it used to be that if you wanted to do science, there was only one game in town, and that was the US. And that's just that. I mean, that was why I didn't do a study abroad year when I was in college at Indiana University. I have to bring that up. And so now, it's different. And people can go wherever they want. They don't have to worry about gun violence. If you're a parent, you don't want to send your kid to some place where they could be unsafe. But now, I had a student who was accepted into our PhD program who said that they could not go to the US at this time as a Black man. They just didn't feel comfortable. And so that's a reality. I'm sure that other programs are seeing that.
And I have one more question before Andrew gets one more in, and that is on the sort of pandemic preparedness front and the meetings that you go to and the plans that are having. Is the same thing happening in public health, global health planning that's happening in other areas, which is that people that we normally would have worked with are saying, well, we have to do this without the Americans. We can't depend on them. And even if they say they'll be around, they're actually from now on sort of unreliable. And let's they can hang out, but we don't really care what they say because they're not reliable.
Yeah, I mean, all of our international treaties rely on good faith. or at least some strategic self-interest, and we're demonstrating neither of those things. And so it's really hard to rely on a partner that is so capricious and cruel. And when you see the destruction of USAID, and you see what the changes at the State Department, the America First, and the rest of it, that's not a good place to start diplomacy.
Angie, you want to ask anything else before we widen the panel here?
I have a crazy question. Do you think that there's any relationship between the fact that the people who are trying to completely undo the national vaccination program continually cite Denmark while we are on the verge of invading Denmark and Greenland and tanking NATO?
I was
Do
so
you
wondering
think there's
that.
any
I was so wondering
relationship
that.
between those two things? I'm trying to figure out if there is. I don't know if there is, but it just seems like a strange coincidence that we start hearing Denmark, 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 and then that's going to be the thing that undoes NATO.
I mean, it could be, but there's so many things that are just haphazard and kind of chaotic that it's really hard to know without them saying directly. Isn't Tracy Hoag from Denmark? So, I mean,
she's from Wisconsin, I think, but she married a Danish guy and she is a Danish dual citizen.
Okay.
But more importantly, it's also the University of Southern Denmark that was awarded $1.6 million to conduct an extremely unethical study on the non-specific effects of the HBV, the hepatitis B vaccine, in Guinea-Bissau, which is, we were talking about the cruelty of all of this. I mean, Guinea-Bissau has a 20% HBV chronic infection rate in its population, one of the highest child mortality rates in the world, and has been profoundly affected by the withdrawal of PEPFAR and USAID funds, creating a huge health and security risk in that region of Africa, and creating a huge problem, a huge health problem for people in Guinea-Bissau, a much bigger health problem than the many health problems they already face. So that was also Denmark, and even though there are also studies from Denmark that are conducted very well and very ethically, and those ones don't usually show a relationship between vaccines and bad outcomes. So RFK, in turn, has attacked like the good Danish scientists, and at the same time given money without any kind of scientific review process for essentially an unethical clinical trial on African babies on another. So yeah, Denmark is all up in the vaccine world. Right. I was just wondering if there's any kind of relationship at all with that in the sort of geopolitical Don Rowe doctrine world.
I mean, who knows? But I mean, we also didn't mention leaving the WHO is another notable thing.
Happens Thursday.
Right. That harms our security as well as our public health.
Hugely.
Well, Dr. Gronvall, if you'd like to stick around for a few minutes, I'm going to bring in another guest. We're going to bring in Dr. Noam Ross, who is the one of the people behind Grant Witness, which is a website that tracks all the NIH funding, NSF funding, now SAMHSA funding that has happened. And I think there's definitely some overlap with global security here. So Noam Ross, thanks for joining us.
Good to be here. Thank you.
Can you just remind the viewers, by the way, of which there are hundreds, and who we're seeing their likes for Dr. Gronvall and Dr. Ross and Dr. Rasmussen. We appreciate those likes and those shares and the comments. So tell us what the hell happened at the NIH this year, just in terms of how many grants were roughly taken away, how many came back, why, and then we'll talk about this whole idea of multi-year funding and other things that are affecting the future.
Sure. So it has been a brutal year at NIH for the people who work at NIH and for the many scientists, research projects, clinical trials, and the patients who are funded by NIH. The agency has lost about 20 to 25% of its staff this year. And over the course of the year, the administration has terminated or suspended funding for over 5,800 grants, and that represents about 1 in 20 grant projects that the agency had funded. It represents those projects represent an investment of more than $10 billion between them all. That has been first an ideological purge in which they have terminated grants and topics they don't like: transgender health, health equity, mRNA vaccines, pandemic preparedness. It's also been a purge of people they don't like. They terminated grants going to researchers who had been brought in through various diversity and workforce broadening projects. And so people, just because they had applied under a program that gives benefits to minorities, people from rural populations, disadvantaged economic situations, they lost their grants, whether they were studying health equity or brain cancer. And then finally, they terminated funding as part of its blackmail campaign against the university sector, terminating and pausing all funding at Harvard, UCLA, Brown University, these series of universities. So between all this, it's been an enormous disruption of the research enterprise in the United States. It's been a real demonstration that the administration is willing to break the promises that are required to do scientific research here. Scientific research requires long-term investment, and by pulling these away on a whim, it's really shaken the foundation of scientific research in the US.
Yeah, and I'm showing a screenshot of your website, Grant Witness, and this is just the screenshot from right before we went live. This tells you not only how many grants and the status of them, but a little bit of information about them. And at various times you could go through and you could see things, and we've covered this before. There were grants taken away. We couldn't quite figure out why, but maybe it's because they don't like the word trans, and a study had the word neurotransmitter in it. That was the level of intelligence that was guiding this. Has that borne out? Was that just a Just So story, or was that like real?
There's been some of that, although when we dig deeper, a lot of it we've discovered is that second category that we found out. We thought, why was this brain cancer grant being terminated? And often, while there might be something like transgenic in the name, and that was one of the first clues, more often that tended to be because, it turns out because that brain cancer grant went to an African-American researcher who got funding because the Enhancing the Minority Workforce program was where that funding originally came from. There are some real crazy ones. There are ones where it's clearly, clerical errors, were part of this termination process. And if anyone was taking care to do it in a careful way, those wouldn't have happened. And there certainly are a lot of stories like that. But most of it is this ideological purge. We do have stories about some of these coming up through word searches and AI-based searches that Doge created, these lists that pushed out. It tended to be a little more targeted than a random word causing it, but these were still really ideological purges by non-scientists thinking they knew better than researchers and imposing their political agenda on the scientific enterprise in the US.
Yeah, so no, I mean, on that note, like the ideological agenda also seems to be quite personal to me. Of the grants that have been cut, like how many of them have been cut, do you know, actually, by, people who are high up essentially at NIH, the principal deputy director, for example, and how many were cuts that were part of just a larger cutting program, if you know what I mean?
We saw this was very, very much a top-down process in the first few weeks and months of these terminations. These letters went out to researchers terminating their grants without the people at the NIH institutes knowing, without the program officers knowing. Often the program officers learned from their grantees that these grants had been terminated. It was happening among a very small people, at the top of HHS, and not even in NIH originally, and then ultimately in the NIH director's office, and these, as part of this Doge operation connected to that. right? We don't know whether sort of these, any individual grant, what the impetus was, but it was very clear from the start that this was something being done outside of the the scientific decision-making process happening at NIH by people who previously weren't connected with the organization at all.
Yeah, and one of the reasons I'm asking is because specifically looking at some of the grants that have been terminated more recently for violating the DGOF, dangerous gain of function research rules, it seems in many cases to be selective. They're not targeting every single person who does work that would potentially fall under that. I have heard stories of other people who have been contacted by their program officers and told to remove certain components of their proposed research, but they're not getting their funding entirely terminated. And it's notable to me that many of the people who are having their funding entirely terminated are virologists, and they are virologists who work on things that the director's office is very interested in. Either interested in completely shutting down or interested in doing themselves.
We do see these very specific areas that have been targeted at part of this broader purge. So we see things specific to mRNA vaccine research being terminated, pandemic prevention, and especially new viral discovery being targeted.
Indeed.
Those projects. And, we see this across the government. For instance, over at the National Science Foundation, there were terminations very specifically on AI misinformation research and disinformation research on the internet. And those things were targeted. Again, really a very specific agenda that you can see how it's coming from the ideological view of this administration.
Gigi, what do you think of terminating grants that are related to AI disinformation? I mean, it seems like maybe this is a bad time to do something like that.
Well, there are lots of different things that people are concerned about with AI, and disinformation is pretty much at one of the very top ones. So that seems like a bad idea to undercut that kind of line of research, because how are we going to combat it? But I was also curious about the gain of function, because some of the grants that were terminated were not gain of function. Like, they were clearly not in that category. So I was kind of wondering if there was any backstory on what got things into that category. Like, some bacterial grants were cut.
This isn't a fine-grained scientific tool that they're using when they're terminating these grants. They're doing, while they're doing keyword searches, the people identifying them are not the researchers, they're not the program officers. They're the people who have their own view on what gain of function might be, what virology might be, right? Like, it's not necessarily experts in the field who are identifying this. So it's it's a shotgun. Like, they're not doing precise targeting.
Mm-hmm. Terrible.
All right. Well, we're going to move over to vaccines and the CDC. So I just want to thank Dr. Noam Ross and Dr. Gigi Gonval for getting us started on global security and NIH grants. We'll have you both back on to discuss where this is heading in 2026. I particularly want to make sure we cover the multi-year grant thing next time, Noam, but we're going to stay on the train tracks here and keep moving. And I have a feeling that, like, when an outbreak happens sometime very soon, we'll be asking Dr. Gonval, gee, how could this possibly have been predicted? So, so thank you both for joining us.
Thank you.
All right, Angie, we are kind of on track here. We're gonna head over to the vaccine and CDC universe. There might be more cursing in this next segment, which I know you want. Which you might enjoy.
I mean, I've been really restrained.
You've been
Jeremy.
Pretty amazing.
I've been on my best behavior.
You've been really great.
I'm trying to take a serious tone because it's been a serious year. Although I do have a lot of swearing to do about the last year.
Yeah. And by the way, for everyone watching, we thought that this format would be good for kind of shorter segments to cover a lot of things. And so today, obviously, we did global security so far, NIH grants. We're going to move over to the CDC and ACIP, but we need to also do other things. So we'll try to do this again with FDA and with maybe USAID, which is part of global security, and also misinformation in general. So if this format's working for you, let us know. And we will continue doing this because really we have to mark this 1 year helliversary, the 1 year of public hell, as we call it.
And 1 year of measles as well. Continuous measles transmission, reestablishment of endemicity.
Absolutely. And I think that it's why people are asking me this question almost every week. Should I get my toddler a dose early? And it's like,
yes,
not a bad question. It's just not easy. All right, let's bring in two people who can answer those questions and more, Dr. Paul Offit and Dr. Dimitri Daskalakis. Thank you for joining us. Let's start with ACIP, the Advisory Committee on Immunization Practices. I'll set the field. When Secretary Kennedy was confirmed, he's told Paul Offit's very good friend of longstanding, Robert F. Kennedy Jr., that he wouldn't tinker with vaccines and that ACIP was sacrosanct. Then in June, he sacked all 17 members who'd gone through multi-year processes of vetting to make sure they were the right people and they had no conflicts, and replaced them with a bunch of mostly like-minded cronies, a few people who have either since figured out a few things or were throwing people like us one little acorn. And they started doing what we expected to have happen, which is they started to roll back the CDC's recommendations on primarily pediatric vaccines, but also COVID vaccines for healthier adults, which is a debate that we've been having for years, and which might have been up for debate, but the way they did it was so insane that no one can trust them. Paul Offit, how's your year been? I think you're mute. Paul. Paul, you're mute.
Unmute. You're good. Okay, sorry about that. It's been awful. I mean, everything that you used to count on, I think the statement, the Achilles shield statement from WHO, is when all the majesty of this world carried, when everything when all that carried weight and always weighed the same lay in the hands of others. That's it. When everything that carried weight and always weighed the same lay in the hands of others, they were small and could not hope for help, and no help came. And that's what I feel like we are now. I mean, people just declare their own truths, including scientific truths. We're supposed to be ignoring experts. In fact, we brought non-experts into the ACIP to just declare their own truths. It's like something I never would have imagined. I mean, you're just nauseated every day about what's going on.
When did you first realize it was as bad as you feared?
I guess the first shot, so to speak, was when so RFK Jr. was confirmed like on February 13th of 2025. The next day there was a headline in a Lubbock newspaper in West Texas stating that there was a case of measles identified in the hospital. So already you knew this was the tip of a much bigger iceberg because most children with measles aren't hospitalized. And then then there was a child death for the first measles death in this country since 2003. And RFK Jr. went on national television on Fox News with Sean Hannity and said, measles vaccine causes blindness. Measles vaccine causes deafness. Measles vaccine causes the same symptoms as measles. That measles, natural measles, can prevent cancer, can prevent autoimmune disease, can prevent cardiac disease. The natural measles was a good thing, and nothing happened. So here we are at the beginning of a measles epidemic where we had a first child death in more than 20 years. And he said that on national TV and nothing happened. And that's when I realized he can do anything he wants. He is above any kind of congressional oversight. And the thing that was frustrating is Senator William Cassidy, Republican from Louisiana, had called me several times before that second committee hearing. And he certainly knew who RFK Jr. was, but I knew he was going to be a yes vote when he said to me the night before, he said, it's tricky. There was nothing tricky about it. It was a political decision from which he is still paying, by the way.
Oh, I think that his vote to confirm, I wrote this many times, but I wrote it again in today's Inside Medicine. Senator William Cassidy of Louisiana, the chair of the HELP committee, his vote to confirm Secretary Kennedy as HHS secretary was one of the worst decisions made by a living physician in the United States in particular. It will go down, and his other work will just simply be wiped away by history. And he did it all to bend the knee to Trump so that he wouldn't get primaried. And now Trump is saying, you know what, I'm going to actually encourage someone to run against you anyway, because quite frankly, Cassidy does regret this vote. And he's been out there saying that he doesn't like what Kennedy's doing, and he's been undermining what Kennedy's doing to the best that he can. And I think it's the reason why I wrote this too, why we don't have a permanent director at the CDC even named, because now I think Cassidy learned his lesson and he said, nope, no more anti-vaxxers. We'll get through my committee. RFK was one too many. And so Dave Weldon's nomination got sunk. Menarez was someone who people could agree on, but when she stood up for vaccines, she was sacked. And now they can't find anyone they agree on. And that's why we have what we have. Dr. Dimitrios Galakis, take yourself off mute and tell us what it's been like at the CDC, or what it was like at the CDC as those early months unfolded.
Yeah, I mean, I think that Paul captured it very well, Dr. Offit. Thank you. I think really it was very clear when I'm going to go even earlier than Dr. Offit, when there was the first ever cabinet meeting, and the secretary made up the numbers of how many deaths there were because he didn't get any information from us. We knew that we were in deep trouble. And so I think that that's really like the tempo and the tenor of what happened, which is that, I partially agree that one of the reasons that there's not going to be a new CDC director is because there's a desire to not go through any sort of confirmation hearing. But why have a CDC director when you can have an independently working body above CDC making all the decisions, so that CDC can just sit there and do science and be a checkbox? That's what it feels like to be at CDC. And I'll give the example. I used to wear a yellow ribbon, and I distributed a yellow ribbon to all of the center directors at CDC, as well as some other leaders, because we were in a hostage situation, and that continues at CDC. It is like a hijacked plane, where the scientists are on the plane desperately trying to do work, responding to the requests of leadership. And those requests are in effect looked at as, yes, CDC career scientists gave us feedback, checkbox, and then we're going to do whatever the heck we want anyway. Sorry, Angie, whatever the hell we want anyway. I'm going to curse for you. So
No,
I know,
please do.
just trying my best. So I think that that's what it feels like to be at CDC. And, the vaccine space is one piece of it. But I mean, the whole thing is in shock and awe because of the riff after riff, reductions in force after reductions in force. Is there an agency for a healthier America? Is there not an agency for a healthier America? So it's kind of in this shock and awe phase where like it's actually in full it's in full suspended animation, because it's not actually involved in anything beyond posting some data online, and then political say whatever the heck they want. And these ACIP folks, all the decisions for ACIP have already been made. Period.
Totally.
There's nothing there. There's nothing there except for theater. So I think ultimately scientists are earning their money by doing the work that they normally do. It is reviewed, evaluated, thrown out, and then the decisions are made based on what the fiat is of Robert F. Kennedy Jr.
Dimitri, can you, as someone who left the CDC in August or September, I can no longer remember, but you ran NCIRD and you know people there and you're in constant contact. The headquarters was shot at hundreds of times. The secretary had rhetoric that many people feel encouraged that indirectly, if not directly. Can you and yet many CDC scientists I speak to on a regular basis are still trying their best. Can you just give us a sense of the kind of the morale on the ground and how they're doing at the CDC right now?
Yeah, I mean, the morale, so speaking for NCIRD, I think that the morale is terrible. So the immunization folks in general, everyone who touches vaccine at CDC, I think are in a really bad way because, I think like Dr. Offit said, like Paul said, there's a complete disregard of experts. And so they're sitting there doing the same quality and high quality work that they've always done. And it's just being blown up. And, they had to sit through today the principal deputy director of CDC saying that like the loss of measles elimination potentially is just, like a risk of doing business. I mean, it's crazy. And so like that I think is as the lab is really firing on all pistons to do all of the sequencing that they need for PAHO for the committee to review the data, while all the epidemiologists are sorting through the hundreds of cases that happened in the last like couple of months of measles. They're being told that none of it matters anyway, so who cares? And so it's not a good place to be. And I think folks are like I said, it's a hostage situation. They're on a hijacked plane. Some people don't have the luxury of saying goodbye, I'm leaving, like I did, and are stuck there. And then others are really working hard, hoping that they can make a difference. But at this point, that place is poised for destruction based on what the HHS leadership is doing. So I don't see that there's going to be a lot of good that's going to be able to come out of that organization for a while.
No, and I think at the CDC, it's transitioning into being a completely political organization. It exists. The scientists will be used like they're being used now, actually, because they selectively take data from the CDC scientists if they can potentially use it. Now, the CDC scientists, the ACIP is a great example. In September, they had, John Su, my favorite, with his soothing voice, talking about vaccine safety data for the hepatitis B vaccine. And that caused just that steady science being presented to them and them having to confront the actual evidence caused so much chaos that they were unable to actually deschedule the birth dose until the next ACIP meeting, which was further delayed because of the government shutdown. And then they barely even managed it. So, I mean, it's like strategic incompetence. But I think as time goes by, they are continuing to get better, and the people that they continue to install at this agency will get better. And what happened at the meeting where they did deschedule the birth dose? No more vaccine safety presentations. If they can't find something that they're going to take from that and use, just like they tried to do when they asked the Vaccine Safety Office to present on one of these studies from the Bandom Health Project, that failed. And so they aren't going to just show any evidence that disagrees with the decision that, as you said, Dimitri, is predetermined.
Paul, I want to ask you about the overall kind of effect on the vaccine schedule that you expect to see. As I was saying earlier in this session, sometimes these things take a while to vest, and sometimes they do not. What do you expect as a pediatrician is going to happen in the next few years as a result of this? And the follow-up is, are our expert bodies like the American Academy of Pediatrics and others doing enough, or are their statements going to help hold the line?
So I think it's going to fall into three categories. The first category, physicians who I've talked to have said they're ignoring the CDC, they're ignoring the ACIP. There is no ACIP, there is no CDC. And they look for pediatricians, it's relatively easy. They look to the American Academy of Pediatrics, who has stood up consistently again and again when RFK Jr., for example, says we're not going to offer the COVID vaccine for healthy young children. ACOG, the American College of Obstetrics and Gynecology, immediately stood up when he said we're not going to offer this vaccine for healthy pregnant women, the COVID vaccine. And similarly, when they moved things to shared clinical decision making, COVID, flu, rotavirus, the AAP has continued to stand up. And so some pediatricians will tell me business as usual, people aren't asking questions, that's good. Then other groups of pediatricians tell me I'm getting a lot more questions than I've gotten before. And so it's taking more of their time, which is too bad because it doesn't enable them to talk about other things they need to talk about, and they only have a limited amount of time. My wife I've never been a private practicing pediatrician. I'm sort of an academician type, that inoculates mice in windowless rooms, that kind of doctor. So she's an actual doctor, and she, as a private practicing pediatrician, she experiences much more differently than I did. But then the third type is that the people are saying, I just don't want to get these vaccines, because that's what RFK Jr. has done. He's made it confusing. He's made one have the sense that maybe these vaccines really aren't so important. Maybe they're optional. But because when you're saying shared clinical decision making, you're saying you can reasonably decide not to get that vaccine, which is not a reasonable decision, which is why you had recommendations. So we'll see how it plays out. There's clearly an erosion in vaccine rates. I mean, with the measles outbreaks, with the amount of tetanus we saw last year, with pertussis deaths, with flu deaths we had last year, equaling the number of deaths we had in the last flu pandemic. I mean, clearly there's erosion, and I think there's going to be a greater erosion, and there's even going to be more of a problem. When you hear somebody like Abraham say, you know, cost of doing business, how can you be more callous than say something like that? 3 people died of measles last year in this country. That equals the total number of measles deaths over the last 25 years. That's our first child death since 2003. Cost of doing business, we eliminated this virus in the year 2000, eliminated circulation of the most contagious human infection. That was something to be proud of. This is nothing to be proud of.
I want the audience also to know that some really important conversations could have happened that are not happening. And because sometimes I think that people just see people, the 4 of us or people like us, and they say, oh, they're just vax this, vax that, inject everything you want. And we're just like having a vaccine party. And in fact, we don't feel that way. We feel that everything has to be on an evidence recommendation framework that is both scientifically valuable and also economically viable. That's part of the framework. Paul and Dimitri, I'd like you to discuss a couple of those conversations that you wish you'd seen. I'll throw one out. The COVID vaccine for a healthy 30-year-old who's had 5 doses, that could be shared clinical decision-making, but the way that they did it undermined that people who are plugged into actual science would actually believe that. And also curious where you fall on HPV, because I think we do have new data. Dimitri and Paul, was this being discussed, and now are we sort of bereft of a real conversation about it?
Paul, I can start, and then Paul, you should.
Yeah.
So, in fact, it was presented at ACIP, I believe in June, what the trajectory was in the work group around COVID vaccine, especially for healthy adults. And the trajectory had been last year, it came very close in the work group for the recommendation to be one that was based on a risk-based recommendation, so based on underlying conditions. But it didn't quite make it because the data wasn't like fully there. Where the work group was going with COVID was it was going to really land at a recommendation that that there could be a risk-based recommendation for folks who are in the sort of middle ages. So that's where it was going. And so, you know, this is what the evidence is. They reviewed the data, they reviewed the information, and then came up with a recommendation that was going to be voted on and probably would have passed. So that's, you know, one thing, which is that, you know, there's, you know, I don't even think that the ACIP folks know that they actually created a recommendation that's more permissive than the FDA approval. I don't think that they were aware that they actually created an off-label recommendation by making it shared clinical decision making. And so that is the problem. So I think that one of the conversations I wish that happened was that any of the people on ACIP were actually trained on vaccine policy, because there was no time. They named these people, and then the next week they were in charge of vaccine policy. And so that's a conversation I wish that happened, that they actually were walked through, hey, this is how vaccine policy works. Obviously, you can iterate on that strategy and on that process, and it can be changed. But what they did was just they walked in like a wrecking ball, going, "I don't know anything, and I'm going to make recommendations because, you know, someone told me to." And so that's the outcome.
Joseph Hibben paid attention to his training. He
did.
He demonstrated that at the last meeting.
Well, no, tell us about that. I remember that moment, and I was wondering, Angie, what did you observe in that?
So I didn't know what to think about Joseph Hibben. I'd never heard of him before he was appointed to the ACIP in June. And, you know, I was pretty suspicious, considering a lot of his work is actually on the effects of mercury during pregnancy. And in the world of vaccines, I know exactly where that's going. But his work has actually shown, he studies seafood now, and has actually shown that mercury exposure doesn't really do anything. So I was like, maybe, I don't know, maybe this guy's good. I'll give him a chance. The last ACIP meeting, I mean, he and Robert Malone went at it. And every single thing that Joseph Hibben said was, we were not trained to analyze evidence this way. Why aren't we using the grade framework? Why aren't we using the ETR framework? He continued to insist on this to the point where he and Malone got into a fight about Hibben's muting ability on Zoom. It was totally ridiculous, as often these things are at the ACIP meeting. But I was really encouraged by that. I was like, there's at least somebody who is a retired, I think, colonel in the public health service who is remembering his training and who is actually standing up for an evidence-based policymaking process. Unfortunately, there's far too few of those people on the ACIP, but they're there.
Paul, I know that you and I have shared some of these views before, which is the idea that for the public to think of us as reasonable, we have to kind of advocate for right-sizing the effects, right-sizing our recommendations and all this. Do you think that there is a way to get these recommendations, like in a post-RFK world, can we get the right size this? I don't think it was too much by much, but it might have been too much by a little. And are these conversations ever going to go back to the rational ones that you were a part of?
First of all, we're in a post-RFK world. We're just not in a post-RFK junior world. That's the problem. Right. I think so. I do think I agree with Dimitri. I think certainly in retrospect, and it's always easy in retrospect, we could have done things differently. Other countries were much quicker to try and recommend the COVID vaccine for high-risk groups, and the goal being to keep people out of the hospital, keep them from dying. So who was getting hospitalized, who was dying, but fell into several high-risk groups. And I think we could have more earlier gone to that and made that clearer. Also, I think when we shuttered businesses or when we restricted travel or we closed schools, I do think we could have, it's always easy in retrospect, I think we could have involved the business community, involved the educational community in some of those decisions as well, because it came off as a little bit top down. I mean, RFK Jr. said this, and I think that he was right. There's two things he said that I agreed with. One is he said he is in this position because of the COVID pandemic, and I think that's right. It's this rejection of the government. The other thing he said that I agree with was when he said, "Don't get your medical advice from me." Those are the two things he said I agree with. But I think it's always easy in retrospect, and I guess the bigger question now is how do we get that trust back?
Yeah, I mean, I think I'm just going to jump right in here, Paul, because I have really strong feelings about this. We all did the best that we could during the pandemic. Communication during these situations is extremely difficult. I remember getting these insane questions about, like, if you heard the new variant yet? I'm like, about the new variant yet? It's more transmissible and it's like killing people. And I'm like, where's the preprint even? And it's like, well, no, it was just a press release from like this university here. And it's like the Ohio variant, never happened or whatever. And I mean, of course, like communication, none of us had been through something like this. The last pandemic was the 2009 H1N1 pandemic, which we're all like, brace yourselves. I was a postdoc at the time in a flu lab. And it's like, okay, well, it's not that serious. Like for the flu people, we got a new virus to work with, but it's not a flu. It's not 1918 kind of thing. And then COVID happens and it's much worse. And, none of us, we'd all been writing grants, like saying that this is going to happen and we didn't know what to do. And I mean, in 2020, there was so much goodwill. By 2021, that was gone. But I think to get the trust back, we need to get rid of the people who are the reason that we lost it. We didn't lose trust just because we communicated badly. We didn't lose trust because we had some bad policies or because Fauci told a white lie about masks or whatever. We lost trust because people lied about us. And they continue to lie about us. And now they're lying about us and vaccines and science and public health with the Department of Health and Human Services logo above it. And until we remove those people, we won't be able to get it back.
No, I think that the irony of RFK Jr. is that he will say that he's making all these moves to regain trust. And in the process, he's losing more and more trust because he makes so many false claims, one after the other, without ever apologizing.
And let me put numbers to that. Jay Bhattacharya wrote a piece in Nature Medicine, who published that essay for reasons that are unclear to me, because Nature Medicine is a good journal that will soon regret that because it essentially was a snoozer policy piece dressed up in some political rhetoric. And he pointed out this lack of trust in public figures. I'll just point out that even despite the fact that they've made Anthony Fauci this boogeyman, this whipping, whatever, he maintains public support well into the high 50%, whereas RFK, who has the whole United States propaganda machine at his back, is in the 30s. So yeah, Jay Bhattacharya, you're right. People don't trust public health, but one, it's because of people like Secretary Kennedy, and two, somehow the public still, by and large, does get it. I just want to point out, and this is something that Gigi Granvall wanted to point out. Yes, we were imperfect in terms of like understanding the virus, and I think that people were a little bit imperfect about some of the promises they made, and a little bit of some confusion about whether going back and forth is the same as going with the evidence. Okay, you need a mask or you don't. That could just be conditions changing as opposed to getting it right or wrong. But I think that what is never remembered is that the loudest voices who criticized those who were in charge, had they been in charge, we would have had mass death. The number one thing that Dr. Jay Bhattacharya wanted us to do in 2020 was the Great Barrington Declaration, which was advocating for a herd immune strategy to get through this pandemic. And that was incorrect. That would have increased the number of people who got COVID before the vaccine. That alone would have made the excess mortality even greater. So I don't like this idea that Anthony Fauci had to be perfect and that other people who were imperfect, like Dr. Fauci, were indeed human, whilst the people who are now coasting their way to prominence were advocating for a policy that was impractical at that time, although I think that some of the ideas could be studied and done. I want to say that in the future. But at the time, we could not do those things, and they were essentially advocating for more death trucks before vaccine.
I mean, here's what
they get no heat for it. They get no heat for it.
Jeremy, I mean, here's what they were advocating for. Old people, sick people, permanent isolation. Everybody else, go out and get COVID. Kit Yates and a couple colleagues modeled this in like 2022, I think. If they had applied the same level of lifting restrictions that the Great Barrington Declaration called for, 1.1 million more people would have died in the U.S. Oh, go ahead, Paul.
Here's one thing. I mean, in 2021, RFK Jr. stood in front of, I think, the Louisiana state legislature and said the COVID vaccines are the deadliest vaccines ever made. I mean, we're just 6 months or so into that vaccine, a vaccine that saved millions of lives and tens of millions of lives in the world, and he was discouraging its use. So can you be any more irresponsible?
I mean, he's literally.
I mean, yes, he can be more irresponsible. There's no limit.
Yeah, there's no limit.
There is no limit.
I think my big fear, and this is like the big question I've actually been wanting to ask both of you, because I spend all of my time now trying to predict the next horror show that's going to happen with vaccination. And I think, anyways, it's going to be at the ACIP meeting. This is going to be the big aluminum salt party. I think that going over the Bandem project trial that now fortunately has been canceled, I did a deep dive into this. You know, a lot of these studies focus on the aluminum salt adjuvants for making, you know, the inactivated vaccines bad. So I think that's going to happen at the ACIP. But the other thing that I'm really worried about is that I think that since we're pulling out of the WHO on Thursday, that we won't be sending anybody to the strain selection for next year's seasonal flu. And I think that there's also a chance that Vinay Prasad might require clinical trials that will make any kind of seasonal vaccine, you know, worthless.
Definitely.
Essentially, we won't have them at all.
I mean, I can speak to some reporting that I have not reported yet, that the FDA is actively coming for flu vaccines next, and some of it could end up being right sized in some narrow populations. Dimitri's shaking his head. We can hash it out, but that's fine. We can have that debate, and you can prove me wrong, and I'm totally in favor of being proven wrong.
Right, versus it being announced by a leak, which is what they're going to probably end up doing. I mean, that's like the way that they're rolling. Now, I mean, I think that ultimately, you know, I think that that Angie, your fear of CDC not being at the table, or that US not being at the table for the antigens for the flu and strain selection meeting, I think it's possible. But I think that it's one of the things that is technically an exemption. So they've decided that that's an okay thing to do. Now I'll give you a story, which is that we had the exemption for the last flu strain meeting, and you know, everyone in the world said it was okay, and then we got clapped back by the West Wing because we had let someone go to a WHO meeting. So like it's chaos. No one knows what's going on. I think that CDC and USG folks are going to be at that meeting, but I think it's going to be like hardly visible that they're there. And I'm not sure how much you're going to be able to participate.
The 1984-ness of this is so insane. I want everyone to know that I was told that story, Dimitri, by someone other than you when it happened. That is that the CDC did send someone to the WHO for that meeting, and that was happening outside, even though we had quit the WHO. And I was actually told not to report that at the time because we just wanted the scientists to be able to do it, and putting light on this would actually hurt our ability to get American public health expertise at the table. And so I didn't report that story, which has happened many times. We're just trying to support the health that's out there.
And, right. And so I think, and we know, Vinay does not want there to be an annual flu vaccine for anyone, frankly. I think that's like one of the missions, which I think we can debate, but it seems as if that's probably not a wise idea for most populations. And so I think that like anything that's going to make it take longer, gunk up the regulatory, like that's going to be the apocalyptic event for vaccines, which is like the work to sort of make the regulatory impossible. So the vaccines of their choosing don't make it through. They don't care for seasonality. They don't care about the timeliness. There's a desire not to have that vaccine. And, there's folks who are acting like petulant children to get exactly what they want, no matter how.
And I'll just say,
no, they're going out of their way. I mean, I think I told you that story about how Lizzie Lawrence and Stat reported it, about how at vaccine, they've forced authors at the FDA to withdraw a paper that had just gone through review and should have been in revisions because it showed that COVID vaccines still work for everybody, basically. It said that the benefit exceeded the risks for 6 months to 65. And I mean, they're going to all lengths. They're interfering with journals. They're interfering with the news. They're interfering with all of this stuff. And it's really in service of, like you said, Dimitri, gunking up the works from a regulatory perspective so that we don't really know what's happening until it's gone.
And they do this while having said they were fighting censorship, that they didn't like the censorship on campuses. The only intellectually honest person I've spoken to about this is actually Jeffrey Flyer, who was the former dean of Harvard Medical School, who was sort of on the censorship is bad train a few years ago and sort of going after DEI in a way. And then I interviewed him earlier this year and said, well, who's worse now? And he says, oh, fuck, like this administration's far worse than I ever thought they'd be. I thought they were going to make some things I would like them to do, and some tiny things they are, but they are taking censorship to a whole new level, and he wasn't afraid to admit it. And I was like, I felt like Tim Russert. Okay, sir, you said you're wrong. The issue is now dropped, All right, I do want to wrap up here. I want to comment on one thing that Dimitri said, and then we're going to ask Paul and Dimitri one more thing. Dimitri, if they want to de-escalate something, that's fine, but they have to convince people like me who are sort of convincible. Like I am someone who actually could be convinced that there are populations where we can narrow the recommendations, but I cannot have it on vibes and on internal memos and on overturning FDA science.
I mean, agreed.
Yeah. So yeah. I would not be surprised that if in a parallel universe, someone showed me the COVID data and the flu data, that we could find some people who the recommendations in 2022 were a little out of date. But I need to see that. I can't just rely on someone who actually got to where they were on the promise of finding that evidence, not saying we don't know, let's look at it, but rather than saying we're going to do that. 2026 is 20 days in. Here we are. We are. I always like to ask experts, all three of you, even though Andrew's my co-host here, but I consider myself the least established person here, which is because that's true. And I want to ask each of you, what is something you're watching in the next month or two that tells us where we're headed and if the pushback is working? Let's start with Paul, then we'll go to Dimitri, and then Angie and I will wrap up together.
By pushback, you mean is the resistance starting to win? Is that what you mean?
Yeah.
I guess there's two things that really worry me. One is what Dimitri mentioned, which is that the FDA could slow things down to make vaccines much less available. The second thing is the vaccine injury compensation program. I mean, if they start to manipulate that and make vaccines more susceptible to the slings and arrows of outrageous civil litigation, we'll be back to where we were in the 1980s. We went from 18 companies that made vaccines in 1980 to 4 by the end of the decade. Were it not for the vaccine injury compensation program, it would have been none by the end of the decade. So those two things worry me. In terms of pushback, I do think there there are legal pushbacks that I am optimistic about. I mean, I love the AAP suit now that is moving forward in a Massachusetts courtroom. I think that's good. And there is a resistance out there. And the other thing that I take tremendous heart in is most parents support vaccines, Republican, Democrat, Independent, they do. And I think you're starting to hear from them now that they're worried that they have to give vaccines earlier, worried that they may not have vaccines. I just think as more that happens more and more, I just hope that someday they organize and have a bipartisan march on Washington. I think that would be fun.
All right, thanks so much, Dimitri Daskalakis. What are you looking at? And I agree, by the way, Paul, that the legal stuff is working. I mean, we have seen cases go in the right direction. So hope that continues. Dimitri.
Yeah, I mean, so I first I'm going to say that I have two worries. The first is the VICP, the Vaccine Injury Compensation Program, because that is one really great way to unplug sort of the mainstream production of vaccine. Just remember that MAHA, the patent, also includes a patent for vaccine production. So are we going to have MAHA vaccines in the future with fewer additives that are better for you, maybe less red food dye? So I'm not sure so I'm a little concerned that they're trying to destabilize just production in general for some other nefarious desire to sort of open another strategy for vaccination. The other thing that I'm worried about is the further weaponization of FDA. CDC is already a weapon, so that's done. It's just not a very good weapon because it doesn't have a lot of teeth. The FDA is all teeth. And then I'm just going to say that I have the exact same hope as Paul, and I think Jeremy, what you implied, litigation is our friend here. Like that, you know, I think that seeing some of these cases continue and being successful will be important, because I think that there is really clear stuff that's happening that's illegal. I mean, I think that there's damages that are starting to accrue, and I think a real possibility that if the resistance is picking up, it's going to pick up in the judiciary.
All right. Thank you so much. We're going to say goodbye to Dr. Paul Offit and Dr. Dimitri Daskalakis. Thanks for sharing your views for Inside Medicine and Rasmussen Retorts. We will see you both real soon.
Thanks, guys.
All right, Angie, it's you and me, kid. We can drop the F-bombs now that the adults
Yeah. I think we can drop them in front of Dimitri and Paul anyways, but
I thought that was great. What are your take-home thoughts here?
I mean, I'm glad to hear, first of all, Paul and Dimitri say that they're optimistic about something, because I feel very not optimistic. I feel like it's really important to do kind of the same strategy that I see MAHA using in some ways, to keep just throwing the kitchen sink at the problem until something sticks. And in the course of doing so, hopefully, like, you get the message out there and you actually document like some of the things that are happening. So it's good to hear that they are encouraged by the progress in the judicial system, and I am as well. I think that there's still more that we can do in terms of just drawing attention to this, because I really, really think one of our biggest problems here is that it is boring talking about some of this stuff, like, to average people. The Advisory Committee on Immunization Practices, the National Security, something about emerging biotechnology, the report Gigi was talking about earlier. I mean, these things are policy stuff, and it's very boring, I think, for most people. And the other thing is, you're like, okay, it's going to kill a bunch of children. We're going to have a security crisis. We're going to have a bunch of dead kids. This is reprehensible. We can't have this. But where are the dead kids? They're not going to happen all at once. It's not like we move to shared clinical decision-making for vaccines, and so many people immediately lose their immunity. I mean, that's not how it works. It'll take time for large numbers of kids to be unvaccinated in different communities. And that's exactly why we're seeing this explosive outbreak in South Carolina. This has been coming for years, because this community has gradually vaccinated their children less and less and less. Mm-hmm. So that's what we're going to be seeing. Like, we're going to see the results of this in several years. And by the time that happens, probably, hopefully, Kennedy will be long gone. I hate to think of what will happen if he's still in there. We'll probably all be dead. But I think that we need to really communicate what the stakes are now effectively. And I think just any way that we can possibly do that, whether it's through activism, marches, judicial actions, legal actions, doing media, talking about it, educational outreach, political mobilizing. I think all of those things are important, and we should do all of them in hopes that one or more will actually be effective. And that's exactly what RFK Jr. has done to our national health system entirely. And I think that we should start maybe turning some of those tactics against them.
I think that in the past few weeks and other examples during the year, there were examples of when this administration actually got the message that people didn't like something and they responded. They still do remain vulnerable to that kind of messaging. And I think, for example, the hepatitis B study in Guinea-Bissau, which is actually not canceled, unfortunately, but it's certainly halted while they try to figure out the protocol. And but that this was not random, that this is being slow rolled now, because it was a sustained effort from public health experts, activists, and Danish journalists, as we learned in Rolling Stone, that led HHS in particular to say, wait a sec, we're going to do this, but not yet. And that's buying time for a lot of activism to go forward so that we can do the right thing, hopefully, and that we still have people on the inside. We're going to do part 2 of this, right? Because we need to do, we should cover some other areas. I just want to thank our panelists today. We had Dr. Deidre Gronval of Johns Hopkins. We had Noam Ross of Grant Watch. We had Paul Offit and Dimitri Askalakis, the vaccine expert, former CDC, and Paul being an inventor of the rotavirus vaccine. And of course, virologist and thorn inside of totalitarians, my good friend, Dr. Angie Rasmussen.
Thanks for having me, Jeremy. It's always really fun. And yes, we need to do part 2. I mean, we should just do this regularly.
Yeah, absolutely. And to the
I think
viewers,
it's really important for people to hear from people like Dimitri and Paul and Gigi and Noam, because we all have different expertise. And as we discussed today, expertise is not cool with the administration. And I think there's got to be some way for people to see it.
Yeah, someone said in the comments that this is a panel that we had would never be on TV, and it's true. It might have been during the pandemic at certain times, but this is the format where we can have these conversations. So I appreciate the audience attending, hitting that like button, and subscribing to Rasmussen Retorts over on Substack and Inside Medicine if you're not already doing so. And most of our content is free. I put a little bit behind a paywall for the premium subscribers, but basically the more people who upgrade to support this work that we do, the more time we can devote to it. And I think we both feel that we feel the call. We feel that we have to do that and fill that niche in. So I thank everyone for being here and for your comments and feedback on this session. All right, Dr. Rasmussen, thanks so much, and we'll see you all next time.
Thanks so much.